What's up, everybody? It's Dr. Jay Greenstein here with my very good friend and esteemed researcher, maybe the most important chiropractic researcher that's ever walked the
Oh,
planet,
please.
Dr. Christine Goertz. Well, listen, I'm just calling it like it is. The impact that you've had on me, Christine, and the impact that you've had in chiropractic has been just amazing. You are a professor in musculoskeletal research at Duke Clinical Research Institute and vice chair for the implementation of spine health innovation in the Department of Orthopaedic Surgery at Duke. You have served as the former member of NIH, NCCIH National Advisory Council. You chaired and have served on the board of governors for the Patient-Centered Outcomes Research Institute for 12 years. You served on the CDC Opioid Task Force. Like you've done so much work, not just in the field of chiropractic, but in the field of spine care and public health. So thank you so much for joining me today, so that we could have a little chat about something that you've done that is very difficult to do, but that is remarkable. You've written a book. So why would a world-class esteemed researcher want to write a book?
Well, first of all, thank you for that amazing introduction. I really appreciate it. Do you mind calling my children and just telling them how amazing I am?
I'd be happy to.
I
Text
would
me their
really
phone numbers. I
appreciate
will
it.
call them when we're done.
But you asked a question that I have actually pondered quite a bit myself over the past 3.5 years or so. Why is it that that I chose to write a book and not a book for scientists or clinicians, but for the general public? And why about low back pain? I think it really stems from, so you've mentioned some of the things that I've been involved in over the past, decade or so, and a lot of that is because I'm a very much a where the rubber meets the road kind of scientist. I am only interested in answering questions that can move the needle, that can help clinicians take better care of patients, that can help patients take better care of themselves for musculoskeletal disorders, which is one of the most ubiquitous and hardest to treat conditions that we face in our society today. So what I've learned is that doing the research is necessary, but it's not sufficient. We definitely need good data in order to make informed decisions. But unless that data somehow gets translated into policy, translated into clinical practice, translated into action, it really doesn't matter. And I've been saying this for a really, really long time, but in December of 2019, I was at a National Academies meeting with a bunch of other scientists, and the topic of discussion was non-pharmacological pain management. And there were scientists from all over the country, all over the world, really, that specialize in this particular area. And it was so exciting to hear the latest research and what their thoughts were. But what really stands out to me when I think back on that meeting is what happened at the very end when there were several scientists who got up and said, yes, we need more research. Of course, that's what we do for a living, but we have enough research and we know enough to change clinical practice today when it comes to low back pain. Why isn't that happening? And up until that point, I had been asking that question of myself for a long time, but for the first time, I felt like I wasn't alone. There were
Yeah.
lots of other people that were starting to ask that question. So my train of thought then was, well, how do we get this information out there? So I have spent a lot of time trying to get policymakers to pay attention, health systems and our elected officials and insurance companies. And I felt like not very much was happening. Not that there aren't some positive changes, because there have been,
Mhm.
definitely, but not the kind of transformation that I think our health system really needs when it comes to taking care of low back pain. And really, people that have low back pain are the ones that need the right information the most and are, quite frankly, the least likely to get it. And so that is how I came to write a book about low back pain for people because I wanted to give them the information they needed to make informed decisions so that they were able to manage their pain in a way that actually works instead of going down some really not very good paths, which is all too common.
And what's the title of the book, Christine?
It is called Take Your Back Back, Whole Health Healing for Low Back Pain.
I love it. And it gives the general public, the layperson, the person who doesn't have the medical or chiropractic or osteopathic degree, tools and also knowledge around how to manage their condition appropriately. Some of it could be self-managed, yes, or some of it could be seeing the appropriate provider. Maybe you could speak to what that's like.
Well, Jay, we know that the first clinician that you see is actually a better
Most important decision.
predictor
Yeah.
of what your trajectory is going to be than your underlying condition.
Yeah.
Research shows that people who have a surgical consult, who get an MRI, who get a corticosteroid injection, other prescription medications, but especially opioids, are more likely to transition from acute to chronic low back pain than people, for instance, who start out with a chiropractor with spinal manipulation or acupuncture or massage or some of the treatments that the guidelines now, in unison almost
Yes.
recommend.
Yes. And if you could give advice to the people who are listening to this, who are seeing this video, as to why they need to read this book, right? They're suffering with low back pain or spinal pain. Why do they need to read this book, Christine?
That is the core question, that is the fundamental question. And the reason, from my perspective, I have good news and bad news for people who have low back pain. The good news is there is somebody who is highly qualified. I'm going to talk to the people. There is somebody who is highly qualified to manage your low back pain. That is the good news. The bad news is that person is you. The good news is you actually have the skills that you need in order to do that. Nobody knows your low back pain better than you do. You know what makes it worse, what makes it better, how long you've had it, what may have caused it, or what may have contributed to the pain beginning in the first place. So that is very important knowledge to have. But what many people don't have is the information about where to turn to first for help. What are the evidence-based things that you can do for low back pain? So self-care, things like superficial heat and moving as much as you possibly can, and exercise, and all of those things are correlated with better low back pain outcomes. But I think one of the most important things is to not panic. It is a horrible thing, and I'm speaking from my own personal experience with low back pain now. It is a horrible, debilitating, frightening thing to be in so much pain. And it is automatic for your mind to start going in the direction of, oh my gosh, what's wrong with me? Something horrible must be wrong with me because my back hurts so badly. And if it hurts this bad now, and on day one, it's just going to get worse. What is it going to be like in a week or a month or a year? And oh my
Yep.
gosh, I'm going to be disabled forever. Those are just the natural ways that your mind works. And so that there is a really people who respond to a really acute episode of low back pain by saying, "Okay, I'm laying on the floor right now, so bring me an Advil and an ice pack so I can get up and try to move around and see what's happening," versus, "Oh my God, call an ambulance." Those people are going to have really different experiences, even though their underlying level of pain might be the same.
Yeah, it's great advice. Look, I've ordered the book. I cannot wait for its release. I know you're going to help hundreds of millions of people. They're going to read this book. It's going to change their life. And the word that comes to mind, and I know that this is implicit or explicit in the title, is empowerment. You're literally
Mhm.
empowering people with the correct evidence-based information, scientifically valid information, so they can make good decisions for themselves and live a healthier, happier life. Christine, before we part, any other words of wisdom that you want to share with the audience?
Well, just one thing that I do want to share is that if you find that the type of self-care that you're using, if you know the NSAIDs and the ice packs or the superficial heat are not enough, then I really recommend that you consider seeing a doctor of chiropractic or a physical therapist who specializes in low back pain. When I talk about the evidence, the evidence shows that things like spinal manipulation and acupuncture and massage and just good information about low back pain and information how to on exercise and how to keep moving are really what the guidelines recommend. Everyone from the American College of Physicians to the World Health Organization. And chiropractors have a lot of those tools in their toolbox. So I would recommend if self-care doesn't work after a couple of days to really move in that direction.
I love it. Now, Christine, how do people find your book?
You can find information. My book is going to be published by Simon and Schuster. It is
Ooh.
coming out on October 6th, so it's not quite out yet. But you can pre-order the book, which actually I would really appreciate because pre-orders, it turns out, help an organization, a publisher like Simon and Schuster decide how much effort they're going to put into promoting the book. So you can find out how to pre-order the book on tybbbook.com. So just
TYBB, B as in boy, B as in boy, book.com.
.com. That's exactly right. And there you'll have the choice. You can buy it on Amazon, Barnes and Noble, or independent bookstores.
All right, well, I got my copy. I know all my friends are going to get a copy, so very excited for you. Christine, thank you so much for all that you've done. Your career has just been amazing, and I know there are more amazing things happening in the future. The book is going to be incredible. It's going to be a bestseller for sure. I'll see you on like Oprah and all the other like talk shows, I'm sure. But very excited for you, and
I'll
thank you.
wave to you. I'll be
I'll get a
waving
hey
to you
Jay.
when that happens. Yeah. Hey
I
Jay.
love it. But I really appreciate everything you've done. You've been a great mentor to me, and I so appreciate you. So thank you. Best of luck with the book, and I will talk to you soon.
Thanks so much. Take care.